Hello, my name's Slema, and today we're going to learn more about coronavirus, and I have a special guest with us today. Can you please introduce yourself to the audience?
Hi, thank you, Sam. Um, Thank you for having me here today. My name is Wa'il. I'm a pharmacist. I work in British Columbia in Canada.
I'm going to be asking you questions about the coronavirus.
Okay, go ahead.
Okay, question 1. What is a virus?
Okay, a virus is simply a very tiny particle that causes an infection. Viruses cannot live on their own, so they need to live in a living thing like a human or an animal in order to survive.
So, like, we are their hosts?
Yes, so another name is a host. Yes, you're right. Good job.
Okay. My second question, what makes COVID-19 different than other viruses?
Well, mainly the concern now is how the virus spread. Um, there are other viruses that spread faster, for example, or less. But the concern with the COVID-19 is that once one person is infected, they can transmit that infection to 2 or even 3 people. Um, Unlike other viruses, for example, another thing with the COVID-19 that people that are infected could be asymptomatic, meaning they don't have symptoms for up to 14 days, and they can still infect others. When you compare that to some other viruses, usually other viruses, for example, can infect someone within 2 to 3 days, and then after showing the symptoms, they can affect others. But again, with the COVID-19, the transmission can occur even when people have no symptoms.
Very interesting. Okay, what are the symptoms and ways of testing?
Okay, the symptoms is coughing is one, sneezing, having a high fever or a high temperature, muscle aches, and those are the main symptoms. A difficulty breathing, that's a big one, like in more serious situations. Regarding testing, this is done by taking a swab or a sample of the throat uh, or or an area like in the nose, and then they take it to a lab, and the lab will determine if the patient is infected or not.
Oh, that's very interesting. How it spreads.
Okay, so the way it spreads, it's by something called droplets. So this means that if someone sneezes or coughs, that's how they can move from one person to another. So it's basically by droplets.
How long does it stay on different surfaces?
We're still learning about the virus. Some references say about 3 hours. Other references say few hours to few days. And that's why when we talk about how to prevent it, we'll touch base on that at that time.
Can people get contained through food?
Um, Interesting question. I mean, because we're still learning about the virus, so in terms of most scientists, they say no, it can be transmitted by food. However, that doesn't mean that we don't, wash our hands before and after we eat, or even when we're eating vegetables, washing the vegetables, just as a preventative measure. But in terms of evidence, there's no evidence showing that it can be transmitted from food, even though the virus can contaminate or can live in animals and can be transmitted from animals to humans. But in terms of food itself, there's not a lot of evidence suggesting that that can happen.
Interesting. What is the treatment for it at this current time?
Okay, so at this current time, just because the virus is new, to us. So we're still learning more about it. So there's no treatment in terms of treating the virus itself. What we have now is just treating the symptoms. For example, the high fever, we give Tylenol. But for treating the virus itself, there's no treatment at this time.
Oh, I didn't know that. Okay, how to protect yourself?
Okay, so protecting ourselves is the emphasis would be on washing our hands like several times and for at least, I guess, 20 seconds, singing happy birthday twice. When we cough on our upper sleeve. If we feel sick, we self-isolate, so we stay home. When we're in public, if we're allowed in public, then we maintain something called social distancing, which means that we keep a good distance between us and others, about 2 meters. And again, that's because the droplets can't go past that 2 meters usually. So that's how we protect ourselves. Another thing is we can wear masks, for example, but there's I guess, a bit of a debate on wearing a mask because some people say, or scientists say, that masks should be reserved for healthcare workers, so doctors, nurses, and healthcare providers working in hospitals, and those who really need it. And yeah, so that's how to protect ourselves.
Are children at higher risk than others? Why or why not?
Okay, so the good news for you and your classmates and the children is that children are usually at lower risk than adults. We don't know why. That's how the virus behaves. And there's more complications with adults, especially people that are 60 years and over with other medical conditions. But for children, that doesn't mean that you're 100% safe. You still need to protect yourself. And by that, you're protecting others as well. But children are at lower risk of getting the virus, at least the complications.
I'm so happy to hear that. And my final question is, if I think I have coronavirus, what should I do?
Okay, so the best thing is to follow the recommendations of your local health authority. So for example, here, I can talk about here. If you think that you're infected, first thing, you should self-isolate. Again, that's to protect also others from being infected. And then you can contact like the clinic or the local health authority to guide you on what to do next. Because sometimes they just say, stay at home, self-isolate for 10 to 14 days, for example. And then you can go from there whether the symptoms are gone or not. And the local health authority will guide you. But the first step is to self-isolate. And then if you do call the clinic or want to go to a clinic or a hospital, you should let them know about your symptoms and they'll tell you when to come and how to come and guide you from there.
That's enlightening. Your answers interest me more, and I'm so happy to hear about the ninth question. That was excellent. Thank you for the great information.
Yeah, pleasure is mine. Thank you for having me.
I enjoyed having you. Thank you so much for your time. I'm sure the audience learned a lot, just like I did. Thank you.
You're welcome. I very much appreciate your time too.
Thank you so much again, and have a nice day.
You too. Thank you very much. Thank you, Sam.
Bye.